Hello, I'm Ivan, and this is my video on cerebral palsy. The main goal of this video is not to be an exhaustive teaching session, but the main goal is to help us remember important facts such as those listed below. And to do so, we'll be using quite a few different methods. Let's start with a definition. For this definition, I'll need you to join me as I do a few actions to help us better remember. So cerebral palsy is a disorder of movement and posture due to a non-progressive lesion in the motor pathways of a developing brain. It is the most common motor disability in childhood, and hence it is important for us to know all these important facts. Let's move on to the risk factors for cerebral palsy. One good way to remember them is by using the mnemonic HITS. And you'll see as we go through the three different phases where these risk factors come about. So let's start with the most important phase, the prenatal phase, where 70 to 80% of the risk factors lie here. So using the mnemonic HITS, H stands for hypoxia, I stands for infections, T stands for toxicity such as alcohol and drugs, and S stands for structural abnormalities such as maldevelopment and malformations. Moving on to the next phase, the perinatal phase, where 10% of the risk factors are present here. So an example would be birth asphyxia, chorioamnionitis or torch infections, traumatic breech deliveries, and also prematurity, which can cause intraventricular hemorrhage and periventricular leukomalacia. Finally, we move on to the third phase, which is the postnatal phase, where 10% of the risk factors are present. So an example would be cardiopulmonary arrest due to drowning or strangulation, infections such as meningitis, trauma, which could be accidental or non-accidental, more focused on the head, and finally stroke. So if you were to forget HITS at any point in time, remember that CP is one of the main risk factors, CP, which stands for a child who is premature. Let's move on to the types of cerebral palsy. And one good way to remember the types of cerebral palsy is to link it with the location where the lesion is. Let's start with the first major type, which is spastic cerebral palsy. And this is the most important one because 70 to 80% of cerebral palsy is under this variant. So spastic cerebral palsy is due to a lesion in the motor cortex which prevents the planning and control of voluntary movements. This results in the inability to receive GABA inhibitory neurotransmitters, causing certain muscles to be stiffer than other muscles. Spastic cerebral palsy can then be divided to three subtypes. We'll start with the first. So diplegia, as the name states, would mean that the two legs are affected more than the arms, resulting in a scissoring gait and a tiptoeing gait. The explanation for that is that the thigh adductors and the calf muscles are stiffer than the rest. An important point to note is that the diplegic spastic cerebral palsy is commonly caused by periventricular leukomalacia, and this is quite a famous exam question. We move on to our second variant under spastic cerebral palsy. Hemiplegia would remind us that half of the body is affected, with the arm in a dystonic posture, more affected than the leg, which would be in a tiptoeing gait. And this particular variant is more commonly caused by a stroke. Finally, we reach the most severe form of all, the quadriplegic spastic cerebral palsy, where it is associated with a whole host of problems which we will go through later. So now that we have covered the main variant of cerebral palsy, we will come across two rarer forms. The first one being dyskinetic cerebral palsy, where the lesion is located in the basal ganglia, and this causes involuntary movements such as dystonia, atetosis, and chorea. Dystonia and atetosis are similar in the sense that they are both simultaneous sustained contractions. The only difference between these two would be the locations, dystonia being more proximal, the trunk muscles, and atetosis being on the distal limb muscles. Chorea, on the other hand, would be dance-like movements, and one good way to remember them is to remember how Daniel Sturridge celebrates his goals. So there are two important points that we should remember in terms of dyskinetic cerebral palsy, and that would be the presence of variable tone and that intellect is relatively preserved in dyskinetic cerebral palsy. Now let's move on to the third rare form of cerebral palsy, and that would be ataxic cerebral palsy. And the part of the brain affected here would be the cerebellum, resulting in the loss of coordination, balance, and fine movements. And one way to remember it is by using the mnemonic Danish, which stands for dysdiadochokinesia, ataxia, nystagmus, intention tremor, staccato speech, and hypotonia. And if you remember all these, you'll be able to picture an unsteady, poor coordination shown in this portion of cerebral palsy. The fourth bit would be the mixed pattern, which incorporates certain elements from all three that we have discussed previously. So now we come to the associated problems with cerebral palsy, and the best way to remember them is the head-to-toe approach. So let's start with the head. Learning disabilities, behavioral problems, and epilepsy. The eyes, visual problems such as squints. The ears, problems with hearing. The mouth, speech, language, and feeding difficulties. The chest, recurrent respiratory tract infections. The tummy or the abdomen, poor growth due to feeding and swallowing difficulties. The hips, hip subluxation. And when we come to the knees, joint contractures. And the back, scoliosis. Moving on to the diagnosis of cerebral palsy, it is similar to other diseases in the sense that we have to have a good history, examination, and investigations. Let's start with the history. As we all know BINDS very well, let us focus on the birth and developmental history. And in specific, we will be looking for prematurity of birth, infections during the perinatal, prenatal, or postnatal periods, and in terms of developmental history, motor skills that are not achieved. So now we come to the examination, where a complete developmental assessment is important. Here we are focusing on the muscle tone, primitive reflexes which are never gained or sometimes delayed loss, and other features such as gait, feeding, and hand preference. Now we move on to imaging or investigations, and here MRI or ultrasound can be useful in detecting the area of lesion, for example, periventricular leukomalacia in a premature baby. And gross motor function classification system is one of the good definitions of the spectrum of severity in cerebral palsy. Now we move on to management. Just like any disease, a multidisciplinary team is important for the management of cerebral palsy. And one way to remember all the members of this team would be the mnemonic POTS. P stands for physiotherapy, O stands for the occupational therapist, D stands for doctors and dietitians, and S stands for speech and language therapist. Here's a quick run through of some of the things that can be done by all these individuals. Doctors could give medical or surgical treatment, and an example for medical treatment would be baclofen as a muscle relaxant. In surgery, certain surgeries to loosen tight muscles can be done, and this would help with all the contractures as well. The physiotherapists will be more focused on building muscle strength through exercise and reducing the contractures through very carefully planned routines. The occupational therapists, on the other hand, would focus their efforts more on the equipment and helping these children achieve a normal life. When it comes to the speech and language therapists, feeding and swallowing would be the areas of focus, and this would also include nonverbal communication. Finally, we come to the dietitian, which would emphasize on safe and adequate nutrition via proper routes. So we've come to the end of the video, and just to recap what we have gone through, the definition of cerebral palsy, we tried remembering it using actions. As actions speak louder than the words, remember this, that cerebral palsy is a disorder of movement and posture due to a non-progressive lesion in the motor pathways of the developing brain. So we've covered risk factors where we use the mnemonic HITS, H for hypoxia, I for infection, T for trauma or toxicity, S for structure or stroke. And if you forget that, remember that CP means a child who is premature is predisposed to cerebral palsy. We've gone through the types of cerebral palsy, linking the parts of the brain affected to the types. We've gone through the associated problems using the head to toe approach. We've gone through diagnosis, placing emphasis on history, examination and investigation, and finally management, where we emphasized on the importance of multidisciplinary teamwork with the POTS mnemonic as a reminder. Thank you for listening.